Hello everyone, we've met again on Prof One TV, and as usual, I'm Emmanuel Ous, the CEO of the Disability Awareness and Inclusion Organization in Ghana. In fact, it's a privilege to always have you with me on Prof One TV to learn together, discuss together, and share knowledge together. In fact, it's a great opportunity, and I say a very big thank you to all my subscribers, all people who shares my videos. In fact, may we all be blessed in our doings. So, what is going to be our topic for discussion today? Today, in this episode of our videos, we are going to talk about substance use addiction. In fact, I encountered a situation just a day before today, and the situation was, in fact, beyond control, and that is what has triggered this topic for discussion today. Now, we're going to deal with substance use addiction. So, when we talk of substance use addiction, what at all comes to mind that substance addiction? So, substance use addiction. So, we define and explain substance use addiction as the obsessive and compulsive use of drugs, yet being unable to stop. Obsessive, you are obsessed with the substance you are taking, and compulsive, you take it without thinking twice, so you get addicted to it. So, substance use addiction is the obsessive and compulsive use of drugs without being able to stop. It's not about the obsessive and the compulsive use of the drugs, but the point of you not being able to stop it is where the addiction comes in. So, the substance use is that you are obsessed with the drugs, of course, you are taking, and you take it compulsively. You take it without thinking of its effects, its complications. And then the addiction comes in when and where you are unable to stop the use of the drugs. So we say substance use addiction. Now we've come to understand what substance use addiction is, which is the obsessive and compulsive use of drugs without being able to stop. You are not able to stop the taking of the drugs you are addicted to. So, in being addicted to these drugs, an attempt of stopping the use of the substance becomes difficult, and it comes along with different complications. So, in your attempt to stop taking the drugs which you are addicted to, results in withdrawal symptoms, of which we will talk about it later. So, in our whole discussion we are going to talk about today, we are to get to know, we are to understand very well what an addiction or what substance use addiction is, and also the addiction stages of addiction, or how addiction occurs. We will get to know all of that. How you are addicted to what you are doing, trying so hard to stop, but yet you are unable to stop. That is what we refer to it as substance use addiction. So, addiction is not only about drugs. You can be addicted to several things, including sex. We have some people among us who every day wants to have sex. For example, a lady or a woman always trying to have sex with men, or a man always trying to have sex with women. In every 1 hour, in every 30 minutes, in every 2 hours, that person wants to have sex. Someone may be addicted to a certain food or even the mobile use. Mobile phone we use every day, one can be addicted to it. And an attempt to avoid or to do away with the phone becomes a problem. And that is what we refer to it as withdrawal symptoms, which we will talk about that in the stages of withdrawal. We will deal with all of that, or the types of withdrawal. So now we've come to understand what an addiction is, which we explained addiction as the obsessive and compulsive use of drugs. The obsessive, you are obsessed, you are always enthusiastic, you are always so eager to take the medicine or to take the drugs or to use whatsoever you are addicted to, and you take it compulsively, you take it without thinking twice of what can this bring, what can this cause, or what is the effect of taking this. So you just all you want is that I want to take this drug, I want to use this thing. That is substance use addiction. Now, how does addiction occur? What are the stages in addiction, substance use addiction? How do one get addicted to something? So most of the times it happens that you encounter something or you get access to something just a day, or not just a day, let's say just a second or in a minute. You try to say, oh, this thing, should I test to see how it is? Should I try to get to it and know what is in? So we have stages of addiction. And the first stage in addiction is experimental use. Experimental use is the type of addiction stage where you take the drug for your first time. So the first time of using the substance, example, say, let me try and see how it works, how it tastes, how it feels. Experimental use. You want to know how it is, how it works, what is in. So the drug, of course, you've gotten access to the drug and you want to know how effective this drug is. So you say, let me take one and see how this drug works. That becomes an experimental use. You want to know how it is and what goes into it and how it works. So the first stage of addiction, getting addicted to a drug, how addiction occurs, is the experimental use. That is your first time of using the substance, of using the drug. Now, you've attempted it for the first time. Then the second stage of addiction becomes vocational use. So for the first time you took it, you were like, oh, the first time I took it, which is the experimental use, I was able to work very hard. I was able to do this. I was so good at it. The first time I tried it, it was so good. It helped me a lot. So you then make it a vocational use. Anytime you want to do that particular thing again, you do what? You want to take that particular drug. You always want to take that particular drug. At any time you want to do whatsoever you took it and it helped you do it better, or you felt how it is. You felt the energy. You took the drug and you realized that, yes, this has boosted me. Okay? That is vocational use. The irregular use of the drugs. So you take it today, in the next 2 weeks or in the next days, next months or a time to come, you also feel like taking it again because the earlier you took it, you realize the effect of it. So, vocational use. That is the second stage of how addiction occurs. You experiment it in the first stage and then it becomes irregular. That is vocational. You want to take it again and see its effect again as it helped you or as how you felt in your first time you took it. You want to experience it again. That is the second stage of substance use addiction. Now, the third stage of how addiction occurs is the regular use of substance. Regular use of substance. So over here, you becomes so attached to it, not very deep, but you tend to always you are well and you are so eager to take it consistently. Every day you want to take it. Every day you want to take it. Regular use. You want to take it so often to be able to do what you can do, what you want to do at your best level. Regular use. You have experimented in the first stage. You try to taste how it is. You try to test how it is. You come to vocational use. In 2 weeks, in 3 weeks, in a month, you try to take it and see its effects. Now, regular uses, every day you want to take it. Every day, at any time, you want to take the drug, the substance. You want to take the particular thing. You want to get involved in the particular activity you did and you felt it so good. That is regular use of substance in addiction stage, which is the third stage of how addiction occurs. Have you ever been addicted to something before? And are you relating it to what we are discussing now? How did you get addicted to what you are in now? Did it happen as we are explaining today? You experimented it, you try to know how it works, how it feels. Then, vocational, in time, you want to, okay, I did it yesterday, it helped me this way. Let me try it in 2 weeks' time, in a week time. And it helped you again. The next stage becomes regular use. You always want to take it because of how it works for you. Then from regular use, we move to addiction, where you have taken it regularly and you are unable to stop now. Now you have taken it consistently and now you are not able to stop. That is where the addiction comes in. From regular use, every day to day, you take it. You take it daily. You engage in that particular activity daily. Example is those who takes cocaine and the weed. Sometimes people refer to something as red, but red is in different forms, so we often don't mention it as a kind of drug that one can be addicted to. But a typical example is those who takes cocaine and the weed. You take it for the first time, experiment. The second time, the third time, vocational. Then regular, everyday use. Then now you are unable to stop. That is where the addiction comes in. Once you have taken it consistently, and now stopping it is so difficult for you that in every 5 minutes, in every single minute, if you don't take it, you are dying. That is where addiction comes in. That is when addiction sets in. So the first stage, experimental use of substance. The second stage is the vocational use. The third stage is the regular use. And the fourth stage is the addiction stage. Here, you are unable to stop using the drugs. So addiction has set in. And then the very last stage of how addiction occurs is the withdrawal stage. Now you are addicted to the drugs, very high to the extent that when you try to stop, you are like scratching the body. When within 1 minute, within a day, and you haven't taken the drug, you are like, you are so tense. You are shouting. Some ends up crying. You see squeezing the body. That is withdrawal stage. So for some people, it's like when the withdrawal stage sets in, they we have something like daydreaming. It's like they are seeing things that are not seeable. Seeing this this small thing becomes like a whole mansion for them. So big and huge. They think like the whole building is collapsing. That is withdrawal stage. So are you relating? Have you encountered such people before? Have you met such people before? They were like, hey, there's a ghost, there's a spirit, something is coming to me. They are like running. That is withdrawal stage. It is not their fault. They haven't gone mad. They haven't gone mad. That is the very last stage in addiction, substance use addiction. Now, getting to know what an addiction is, what substance use addiction is, how addiction occurs, then getting to withdrawal stage. In withdrawal stage, we have two main forms. There may be other forms of withdrawals, but here we will talk about the two main forms of withdrawal stage, which are the physical withdrawal stage and then the psychological withdrawal stage or the cognitive withdrawal stage. The physical withdrawal and then the psychological withdrawal. In some fields, or the psychological withdrawal can also be referred to as cognitive withdrawal stage. Now, what is the physical withdrawal stage? The physical withdrawal stage is the physical experience that the person go through, the physical experience of the person. So the withdrawal stage, the physical withdrawal stage, for example, is like vomiting. So for someone who is so addicted to certain drugs, anytime the person is trying to stop the use of the drug, which is the withdrawal stage, and being unable to stop, because the person wants to have the drug, take it again, and not getting it, the person ends up vomiting. The person ends up scratching the body. You see all over the face, trying to mess up the skin. That is the physical withdrawal stage. You see some people shouting so loud that you can hear from a very far distance. Some react to the extent that when other people are getting closer to them, they want to run away because they see them as a danger coming to them. They see them as something dangerous that is approaching them. So they don't want everyone to get near to them. It takes professional to deal with those people. Don't attempt to force them, because at that very instant their strength or their mind is not in the normal state. So if you attempt or if you try to apply force, then you face something that you haven't perhaps ever faced before. That is the physical withdrawal stage. The reaction of the person when trying to stop the addiction, the physical, the visual actions you see the person is demonstrating, vomiting, shouting, crying, isolating, these are the physical withdrawal stage in substance use addiction. Now, the second stage is the psychological withdrawal stage. And the psychological or the cognitive withdrawal stage is the obsessive thoughts of the person the obsessive thought of the person as a result of trying to stop the substance. So, example, daydreaming. It's like I said earlier, the person see something so huge, like this is there is a car coming to hit me. They see spirits. Meanwhile, it is never a spirit. As you, the individual who you claim to be in your normal state, approaching him, they see you in a different way. That is the psychological withdrawal state. So they think that something is actually happening to them. Meanwhile, there is nothing. There is something occurring. Meanwhile, there is nothing. They see that they are in water. The room which they are in, or the room which the affected person or the addicted person is in, they see it like they are in swimming pool. They are in flood. There is flooding all over. They see it like they are in the forest. What they are seeing is not what you are seeing. So when you are trying to get close to them, that person can take something and hit you to the extent that you may even pass away. Yes, because he sees you as an obstacle, as a dangerous thing coming to attack him. That is the psychological withdrawal stage. Now, how do we help such people to recover from their addiction? The substance, the drugs that they have used for a number of days, for a number of years, for a number of months. How do we help these individuals to recover? I mentioned earlier in the discussion that it takes professionals. It takes multidisciplinary approach. It takes teamwork, which brings together different professionals, various experts to handle that particular person, to help that particular individual to recover from the addiction. Now, we have talked about what an addiction is. We have discussed the stages of addiction, and then we've gotten to know the withdrawal stages in addiction. When one is addicted to drugs and then trying to stop the use of the drugs and being unable to stop the withdrawal stage. The signs and symptoms of the person is what sets in, or we refer to it as withdrawal stage. Now, how do we provide interventions, or how do we help such people to recover? So we will discuss that in the next episode of our videos. Perhaps we will get different professionals. We will see different experts in handling or providing rehabilitation for people who are addicted. Like I said, not just addicted to drugs, but it may be different things. Addiction occurs in different ways. Have you seen some individuals who are acting in some ways and you don't know what is happening to them? Connect in the comment section and let's bring together those people and help them also get back to their normal life. If you want to know various places where individuals who are addicted to drugs and other substances can receive treatment, fully recover from their substance use, just give a comment in the comment section box and we'll take it from there. In fact, we take it from there and help them. I'm referring to the people, the addicts, to also come back to their normal life again. Thank you very much for staying with Prof. One here again, and I believe very well that we have learned something valuable today, which henceforth we are going to look around very well, not to be attacked by individuals who are addicted. let's be very careful as we go in and out every day, trying to go get something and bring it back home. Let's be careful of the different people we meet out there, because not all of us, not everyone is in his or her normal state. Let's be very vigilant as we move out day in and day out. Thank you once again for watching Prof. One TV, and I look forward to seeing you again in the next episode of our videos. We have a lot to learn, so I encourage you to stay tuned on Prof. One TV. Look up to Prof. One TV every day, and also put in a particular section where you don't understand. And I assure you that Prof. One will help you to get it better what you are not getting it now. See you later.